Tirosint-Sol, also known as levothyroxine, is used to treat an underactive thyroid gland, also called hypothyroidism. It works by replacing or providing more thyroid hormone, which is important for normal mental and physical activity. Low thyroid hormone levels can occur naturally or when the thyroid gland is injured by radiation/medications or removed by surgery. This medication is also used to treat other types of thyroid disorders, such as thyroid cancer. It should not be used to treat infertility unless it is caused by low thyroid hormone levels. The daily dosage and optimal timing for taking Tirosint-Sol should be determined by a healthcare professional. Before taking Tirosint-Sol, make sure to read the patient information leaflet and instructions for use from your pharmacist. Always ask your doctor or pharmacist if you have any questions. Take this medication by mouth as directed by your doctor, usually once daily on an empty stomach, 30 minutes to 1 hour before breakfast. If you are using the medication that comes in a bottle, use a special measuring device to carefully measure the dose. Do not mix with any other liquid. If you are using the medication that comes in an ampoule, you can take it by mixing it in water or take it directly without water. The dosage is based on your age, weight, medical condition, lab test results, response to treatment, and other medications you may be taking. Take this medication regularly at the same time each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as thyroid replacement treatment is usually taken for life. It's important to note that there are different brands of levothyroxine available. Always consult your doctor or pharmacist before changing brands. Additionally, certain medications can decrease the amount of thyroid hormone that is absorbed by your body, so be sure to separate them from this medication by at least 4 hours. If you experience symptoms of low thyroid hormone levels, such as tiredness, muscle aches, constipation, dry skin, weight gain, slow heartbeat, or sensitivity to cold, make sure to inform your doctor. And if your condition does not improve or gets worse after several weeks of taking this medication, consult your doctor. During the first few months of using Tirosint-Sol, you may experience temporary hair loss as your body adjusts to the medication. If this effect persists or worsens, be sure to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, it's essential to contact your doctor immediately if you experience any of the following serious side effects: increased sweating, sensitivity to heat, changes in mood, tiredness, diarrhea, shaking, headache, shortness of breath, bone pain, easily broken bones, chest pain, fast or irregular heartbeat, swelling in the hands, ankles, or feet, or seizures. While rare, a serious allergic reaction to Tirosint-Sol is possible. Seek medical help right away if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not mentioned. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. This medication is not meant for weight loss. Taking normal doses will not help with weight loss, and taking large doses can lead to serious, possibly fatal side effects, especially if taken with diet pills. It is important to take the proper dosage as prescribed by your doctor. Before taking Tirosint-Sol, make sure to tell your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history with your doctor or pharmacist, especially if you have conditions such as increased thyroid hormones, heart disease, high blood pressure, or diabetes. If you have diabetes, it's crucial to monitor your blood sugar regularly and discuss the results with your doctor. Be aware of symptoms such as increased thirst, shakiness, unusual sweating, dizziness, or hunger, and inform your doctor immediately. Before undergoing surgery, be sure to inform your doctor or dentist about all the medications and products you are using. For children, it's important to note that they may be more sensitive to certain side effects of this medication, such as headache, vision changes, and hip/leg pain. High levels of thyroid hormones may affect bone development and growth. It's essential to attend all scheduled medical appointments so the doctor can closely monitor the treatment. Older adults may also be more sensitive to the side effects of Tirosint-Sol, especially fast or irregular heartbeat. If you are pregnant or breastfeeding, it's important to consult your doctor before using this medication. It's important to be aware of potential drug interactions when taking Tirosint-Sol. These interactions could affect how your medications work and may increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If you or someone you know has taken too much Tirosint-Sol and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek emergency help right away. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, reach out to a provincial poison control center. Symptoms of overdose may include a fast, pounding, or irregular heartbeat, loss of consciousness, confusion, or seizures. It is important not to share this medication with others. Make sure to attend any required lab and/or medical tests, such as thyroid function tests, while taking this medication. It is important to keep all medical and lab appointments. If you forget to take a dose of Tirosint-Sol, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose unless your doctor instructs you to. If you happen to miss 2 or more doses in a row, make sure to contact your doctor. It's always best to check with your doctor in advance about what to do if you miss a dose, and then follow their specific instructions. When taking Tirosint-Sol, it's important to store it at room temperature, away from light and moisture. If you have the medication in a bottle, make sure to keep it in the original bottle and use it within the recommended time frame after opening. For ampoules, store them in the pouch and use them within 15 days of opening. Remember not to store this medication in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of Tirosint-Sol, it's important not to flush it down the toilet or pour it down the drain unless specifically instructed to do so. Instead, discard the product properly when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.